I do a lot of consulting for dental practices around the country, and one of the things I always hear is, how do we increase hygiene production? That's like the thing in dentistry right now. Let's increase hygiene production, hygiene production, hygiene production. And the easiest go-to thing is, let's do more and more whitenings on patients' teeth. So let's talk about what that means. Because when I go into dental offices and I say, hey, what kind of whitening are you doing? They'll say, well, we're doing Zoom, or we're doing opalescence, or we're doing smile perfected, or we're doing core, or we're doing some other type of whitening system out there. And if I suggest to them that they should have multiple options within their office to offer patients for whitening, they look at me kind of perplexed, which is, a lot of offices love Zoom. It's fine. So Zoom has got some challenges to it. Good product, and I used it for many, many years. The average office in the United States is doing about 2 whitenings per year with Zoom. So if whitening is the #1 requested dental procedure of patients to dental offices, why aren't more dental offices doing more whitening? Well, what I found out in my own dental practice when I practiced is that a lot of the patients that would come in and wanted whitening, and Zoom was pretty much the only one that we were doing at the time, Zoom caused so much problems for us that the office team chose not to do it. The dental assistant chose not to do it because there was way too much prep time. The dental hygienist couldn't do it because they couldn't convert the patient from a hygiene patient into a whitening patient that same day. And the admins didn't really like Zoom all that much because of the cost of Zoom, and then the calls they got a couple of days later because of the feedback and the sensitivity and the pain and so forth. So what ended up happening is, I found a lot of my office team started referring patients out of the office to go out and buy Crest white strips. Now, Crest white strips it's a wonderful product, and it's an option to whitening. So here's really the challenge. If you want to increase hygiene production, you want to increase hygiene production by doing more whitening, because that's what patients want. They want a brighter and whiter smile. So look around your office right now and decide, are the whitening options that we're offering our patients getting patients to say yes? So are patients saying yes to Zoom? And if they're not, why not? Are patients saying yes to opalescence? And if they're not, why not? Are patients saying yes to smile perfected? And if they're not, why not? And if at the end of that little, kind of figuring things out with inside your dental office, you find out that most of your office team are referring patients out of the office, revenue out of the office, money out of the office, to go to Walgreens or CVS or Costco to buy Crest white strips, you need to reevaluate your whitening strategy among your office. And I think what you're going to find out is, whitening, for example, like Smile Perfected, which is a 20-minute whitening product, is something that patients are going to embrace. It's relatively inexpensive, $99, no pain, no sensitivity, no prep. And those are the kinds of things that you like inside a dental office. It's not to say that you should get rid of the other options, which is something like core or opalescence or Zoom. But what you want to do is, you want to give patients options. That's all we want as consumers, is give me choices as to what I can do to make my smile brighter or whiter. And if after you evaluate the patient and you realize that the patient expectations as far as whitening, what they're expecting from their whitening product, is not something that you can give them regardless of the product, then you need to start having a conversation about possibly veneers or something along those lines. So have the conversation about getting a brighter and whiter smile, whether that means a whitening product or a veneering of those teeth. And when it comes to whitening products, understand what's available in the marketplace and decide what's the way that you can keep the revenue inside the office to increase hygiene production. And the last little tidbit, and you're going to love this idea, which is, what do you do with patients? You've done the crown prep, you're getting ready to take the shade, and now the patient says, I'm thinking of whitening my teeth. And typically in a dental office, that is a buzz killer right there. And when that happens, we're just very disappointed about it. The best part about in-office whitening is you can do the whitening immediately after the crown prep, take the shade and have the patient come back in 2 weeks, or take the shade and have the CEREC machine or the milling machine make the crown right there. So use whitening in your office, understand what's available, and increase hygiene and crown and bridge production by adding that to your armamentarium. Thank you.